In today's video, we are going to be talking about the most commonly seen disorders that you are 100% going to see on clinicals. What's up, you guys? Welcome back. For those of you who are already part of the family, for those of you who are new, welcome. My name is Kiara Selena, and this is my channel, Nursing with Ki, where I make a whole bunch of nursing-related videos, sharing tips and tricks that I've learned along my journey to help you guys have the smoothest nursing journey. So if you are interested in things like this, make sure you scroll down, click on the subscribe button, and make sure you click on the notification button so you will never miss a video from me again. Now, I'm sorry about the changing lights. The sun keeps hiding and coming out, and it's just really messing with my lighting here. But as mentioned in the beginning of the video, this is going to be a video about the most commonly seen disorders you will for sure see on clinicals or just in your nursing journey as a whole. I am by no means a professional or anything, but I've been in nursing school for almost 2 years now. Actually, it has been 2 years, so I've done my fair share of clinicals, and there are certain disorders that you see on every single clinical over and over again. So that is what we are going to be talking about. And this is also a collaboration with the beautiful Jackie Blandon. If you guys have not already subscribed to her channel, make sure you go check her out. She is also a nursing student, and her video is going to be showing how to make concept cards or concept maps to help you guys study these disorders. So make sure you go check that out. All right, so let's start with osteoporosis, the musculoskeletal system. Now, osteoporosis is a disorder that I've seen a lot, especially in the geriatric community. Now, for all of my RNs, for all of my medical students out there who want to correct me, make sure you leave it down below. We don't want to give no false information out here, but I'm going to explain the way I learned it. Now, you have these two little men, one inside the bone and one outside the bone. Now, you know that your bone structure changes several times throughout your life. And the reason why that is because you have these two little men, one inside, one outside the bone, like I said. The one outside is called the osteoclast. We're gonna call him CJ. And the one on the inside is called the osteoblast. We are gonna call him Ben. Now, Ben and CJ are constantly shoveling, right? While Ben is shoveling out, CJ is shoveling in. So Ben is shoveling out old bone so that it can go into the bloodstream, collect nutrients so that it can come back and create better, stronger bone. And CJ is the one who's responsible for actually shoveling that bone in. So CJ and Ben are shoveling at the same time. One shovels out, one shovels in. And they shovel like that at the same exact pace. But when you start to develop osteoporosis, or when you have osteoporosis, your bones become brittle. That's why it's called brittle bone. And the reason why that is because CJ and Ben stop working at the same rhythm. So what happens is CJ starts to get a little bit tired, and he starts to, he's starting to shovel slower, whereas Ben is still pumped up with energy and he's still shoveling out extremely fast. And what happens is you lose more bone than you gain. So Ben is shoveling all that bone out, and CJ is not putting in the same amount of new bone. And so your bones become brittle, which puts you at risk for fractures. So in the hospital, and correct me if I'm wrong, but from what I've seen, most people with any osteo problems, especially osteoporosis, are on calcium and vitamin D. They usually get 10,000 units of vitamin D once a week, as well as their big green calcium horse pill every day, usually around 12 o'clock. But I actually have a patient, because I'm on a ortho surgical unit right now doing a clinical in surgical, and I have a patient who has this big blue horse pill that's 500 units of calcium and 400 units of vitamin D, or vice versa. So sometimes they get it like mixed in a pill, but from what I've seen, most of the time they get their vitamin D once a week and their calcium every day at 12 o'clock. Now, the second one I want to talk about is gout. Now, gout is also seen a lot in the geriatric population, and what it basically is, I like to call it the kidney stones of the joints. And it may sound silly, but for those of you who are in nursing, or a little bit advanced in your nursing career, you guys probably understand why I call it that. Now, when you have gout, what happens is the uric acid levels in your body become elevated, causing these little crystals to go and deposit into your joints. You see see it a lot, mainly in the big toe. That's where I've seen it. But you see it also in the fingers. A lot of times you'll see elderly people with these like big bulges. I'll probably leave a picture somewhere here. These big bulges at the end of their fingers, and their fingers look very deformed, very red. It's very, very painful to touch. And yeah, it's basically caused by high levels of uric acid that happen when you eat foods high in purines. So foods like shellfish, a lot of shellfish, mussels, sardines, scallops, or even bacon and turkey are high in purines. And especially if you drink a lot of alcohol as well, that can be a big risk factor. So stay away from those things if gout runs in your family. But one of the medications that you see, a lot for gout is allopurinol. That's the one that I've seen most commonly. So allopurinol, and as a nurse, you should definitely encourage your patient to increase their fluid intake, drink more water to really flush all of that out of their system. Obviously, there's other things that you can do, and you can give them, for pain and to keep them comfortable. But allopurinol, tell them to stay away from foods high in purines. There's probably some pamphlet somewhere around the hospital about gout that will list all the foods that they should stay away from and increase fluid intake. Now, diabetes. Let us talk about diabetes. There are 3 different types of diabetes. You have diabetes type 1, type 2, and gestational diabetes. Now, I'm not going to talk too much about gestational. I'm probably not going to talk about it at all, but let's talk about type 1 and type 2 and the differences. Now, shout out to Shanna, one of the best teachers I've ever had, who explained it very well, and it has clicked in my head, and I hope I could do the same for you, teaching you diabetes the same way she taught it to us. Anyways, diabetes type 1 is when your body is not producing any insulin at all. Now, insulin is the hormone that helps your body control the sugar levels in your bloodstream, right? So when you have diabetes type 1, your body's not producing insulin, so you get insulin shots, and those insulin shots basically do the job of insulin that your body's naturally supposed to be doing but isn't doing. So you get your insulin, regulates, the sugar levels in your bloodstream. Therefore, the sugar can be used as energy and ... Diabetes type 2 now. It's not necessarily that your body is not producing the insulin. It can be producing the insulin, but your body isn't taking it in, or your cells aren't taking it in the way they should. So the way my teacher explained it to me is, think about a Pac-Man. When you think about a Pac-Man's mouth is kind of triangular, right? It's open like this. But let's say your insulin, right? They're squares, right? Try to fit a square into a triangle. You can't, right? So what the medication does, they get their medication. They might, get medications like metformin or Januvia, sitagliptin. I think they're the same. You have a bunch of different medications, but what those medications do is they turn those square insulin into triangles so that it can fit into the Pac-Man mouth, if that makes sense. So the next one is GERD or gastric reflux. You ever kind of throw up your food and get that really acidic, burning sensation up your esophagus? Well, that's kind of what GERD is. Now, let's talk about GERD. You chew your food, you swallow your food, and right before your food enters your stomach, it goes through this sphincter, a sphincter that opens and closes. It's called the esophageal sphincter. So that sphincter opens, allows for the food to go in, and it's supposed to close, right? You have hydrochloric acid or HCl in your stomach that, mixes up with your food, gets rid of bad bacteria and whatever, and then your food goes lower down in the digestive system. But when you have GERD, what happens is that sphincter that opens to let the food into the stomach doesn't fully close. And I don't know if you knew this, but fun fact, HCl or hydrochloric acid, which is the acid in your stomach, is actually strong enough to burn through wood. That's crazy. So you know how strong, now you probably have an idea of how strong that acid is. So if that sphincter isn't closing properly, what happens is your food is starting to mix with that HCl, but guess what? It starts to back up and go back into the esophagus because that sphincter isn't closing shut. And that's what causes that really burning sensation in the esophagus, which can also cause esophagitis and other complications. So one of the medications that you see a lot, which is usually given before breakfast, so 7:30. It's usually, well, I don't know how it works in every hospital, but the hospital I'm doing clinical at right now, it's actually the night shift people that will give the medication first. And the medication that I see used a lot for GERD is Pantoloc or pantoprazole. They're the same. It's an antacid, I believe, and it's given before breakfast so that when they do eat their breakfast and whatever, it'll prevent them from feeling sick and you know, all of that stuff. So GERD. Now, hypertension, according to Google's definition, and the reason why I say according to Google's definition is because I was really truly trying to find the words to explain this to you guys, but you know when you know something but you're trying to explain it and it doesn't come out? That was me just now. So according to Google's definition, high blood pressure or hypertension is when the pressure levels in your arteries are persistently elevated. And the reason why I stress persistently is because I don't want you to go take your blood pressure right now and see that it's, you know, 140/80 and say, oh my God, I have high blood pressure. You do not have high blood pressure, right? There's a bunch of different factors, a bunch of different things that can elevate your blood pressure. You can be super stressed out about an exam and your blood pressure can be high. That does not mean that you have high blood pressure. You're hyper in that moment, but you do not actually have hypertension. Now, if a doctor wants to diagnose you with high blood pressure, what they will do is monitor your blood pressure over time, over a certain amount of time, and if it is persistently, if it's constantly high, then they will diagnose you with high blood pressure. Now, high blood pressure is very common, but it is very dangerous. It is the silent killer. And honestly, everybody in my family on my mother's side who has died have died from a stroke. Everybody they had high blood pressure, and the risk factors, I mean, they did every single thing that put them at risk for hypertension. They had hypertension, they made it worse with their habits, they got a stroke that then killed them. So let's get into the risk factors, because I really want people to be aware of this. Risk factors for hypertension: smoking, body weight, salt, alcohol. Stay away from those 4 things. If you are overweight and you know that blood pressure problems runs in your family, try to cut down on the weight. My Caribbean people, I know we love salt. We love salt in everything. MSG this, salt on that, put salt on this, you know, all the seasoning on the chicken and all of that. I know we like tasty food, but we got to start cutting down, okay? Alcohol, smoking, keep the risks low. As for the medications that you could take for hypertension, honestly, the list goes forever. You could take angiotensin receptor inhibitors, you can take ACE inhibitors, you can take diuretics. There's a bunch of them. But you know, a lot of the things that you see atorvastatin, you see perindopril, Lasix, which is a very popular diuretic, hydrochlorothiazide or hydrodiuril, which is another popular diuretic. All those diuretics, all those medications are used for high blood pressure. So if you're curious, go in your nursing drug book or go on Google, type them in, learn the differences and how they work. You also have beta blockers that I forgot, metoprolol or Lopressor, or bisoprolol and Monocor, which are the same. Those are also very popular blood pressure medications that are also used for heart problems. The beta blockers. So go check that out. Now guys, this is the end of the video, and like I said, I really would like for you guys to go check out Jackie Blandon's channel, subscribe to her channel, and look at her video. It's going to be really helpful. It's going to help you with making your concept maps. We were supposed to talk about the same disorders, but I had a complication with my phone and now I lost the conversation that we had, so I couldn't remember the exact list of disorders that we agreed to speak about, but I think I spoke about a couple that she's going to talk about. And either way, concept maps are pretty much the same for no matter what disorders. So if you go check out her video, I promise you that will help you in school for sure. Subscribe to her channel, subscribe to my channel. Make sure you click on the notification bell. My goodness, make sure you click on the notification bell. And I really hope you like this video, and I hope to see you next time. Bye.